So the question is, what is diabetes reversal? Before we answer that question, we need to understand that type 2 diabetes is what we are talking about here. And type 2 diabetes is an illness of erratic lifestyle. So if you change your erratic lifestyle more towards normalcy, that will result in more normal body weight, and slowly and steadily that will result in more normal blood glucose readings without the need for many medicines. And that is what diabetes reversal is. So you change your lifestyle enough to reverse your illness to such an extent that you don't need any medicine or very minimal oral medicine to keep your blood glucose within normal range. Technically, that is diabetes reversal. So is it a myth that if you are a diabetic, you are a diabetic for life? Well, it is true if you do not want to change it. So if you do not want to change your lifestyle, and if you do not want to get rid of diabetes, then nobody can help you. I mean, taking medicines is not going to cure your diabetes. Only you can cure your diabetes if you have the right advice, and more importantly, if you have the right willpower. So you just need to want to not have medicine or to have minimal medicine, and it is possible. You just need to follow the advice. And the good thing is that, if you follow the right advice and follow the right monitoring and do the right things, then it's not only your diabetes that gets reversed or improved. It's your hypertension, your high cholesterol, your obesity, which is very, 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 very important. They all improve. And if you improve all these things along with your fatty liver, your high cholesterol, then your risk of having a heart attack or a stroke or a lot of malignancies, they improve as well. And the only thing that you have to do is have the right advice and have the right willpower, and it's very much possible. But if you do not want to change, or if you do not want to improve, then I'm sorry, but no medicine is going to help you. So that's a very good question. How is diabetes reversal program different to normal consultation? Well, in normal consultation with a doctor, you have your 10 minutes of your time with the doctor. The doctor will give you some lifestyle advice. The doctor will give you some medicine and will ask you to come back after 1, 2, 3, 4 months to see what your results are. In diabetes reversal program, it's a bit more personalized. And that is the key, because if you do not personalize your diet as per your requirements or your preferences, if you do not personalize the exercise that you do depending on your, again, personal circumstances, and if you do not personalize your monitoring, if you do not have the opportunity to feedback to the doctor or the team, in the meantime, while you're waiting for the follow-up, then you might just get lost to follow-up and you might just lose your willpower to improve. So that is where the diabetes reversal program is a more long-term commitment from the doctor, the team, and more importantly from the patient. And it's kind of a 6-month program, so to say, where you want to work together with frequent contacts in between to assess your progress and to feedback to the doctor and the team about the problems you're having, so that the doctor can tweak your lifestyle slightly if needed. So that is more like a long-term 6-month or so commitment, by the end of which you should see a significant benefit in your body weight and all those metabolic parameters that we talked about, including your blood glucose. And this is not something for the young only. Even if the elderly, they want to improve their diabetes, for example, patients who are on a lot of medicine, a lot of insulin, for example, if they want to cut down their medicine to basic minimum, they should be able to achieve that. If they're on many blood pressure tablets, again, they should be able to achieve that. But as I said before, unless the patient is willing to make some changes to their lifestyle, the result is not guaranteed. If they want to change their lifestyle and if they follow the advice, the result is almost 100% guaranteed. So it's very important that the patient is motivated. If you are one of those patients who think that, well, I'll go to the doctor and I'll just take some medicines and I'll keep my blood sugar under control, I'll keep my blood pressure under control, I'm sorry, you are not at the same frequency as the diabetes reversal program. Diabetes reversal program is where you want to get rid of your medicine, not keep your illness under control. You want to get rid of your illness, because the illness is not a proper illness, it's a lifestyle illness. So you change your lifestyle, your illness is cured. If you don't change your lifestyle, you need to keep your illness under control by taking medicine. So I hope that the difference is clear. So again, if you want to get rid of all your lifestyle illnesses, get rid of, not under control, then diabetes reversal, obesity reversal, these are the right long-term commitments from you and from the team of doctors and dietitians. But if you want to not commit to some lifestyle changes, some long-term commitment, then normal, regular consultation, keep taking your medicines, keep doing your blood tests, hopefully things will be under control. But you will not get rid of your illness. You'll only get rid of your illness by lifestyle changes and long-term commitment. I hope that's clear. So how do you choose the right diabetes reversal program? I do not think it's very complicated. Although internet is flooded with many programs, I think it's better if you go to a place where you get a personalized approach, where a senior experienced doctor sees you and gives you the right individualized advice. So your advice will depend on your circumstance. So your dietary advice, your lifestyle advice will overall be dependent on your individual circumstance. It can't be the same between a 25-year-old corporate and a 65-year-old housewife. So the doctor needs to be keeping that in mind while giving you the right lifestyle advice. The doctor needs to keep on monitoring your progress. I mean, if you're on loads of medicine, you can't just stop taking all the medicines because you have enrolled in this program. No, I've seen some patients actually going through a lot of emergencies because of this. So no, you cannot stop your medicine suddenly. You need to be under the guidance of a senior experienced doctor and slowly cut down the right medicines, and ultimately hopefully to no medicine, but that medicine dose needs to be reduced slowly and steadily. You need to have the right team of dietitian who is supervised by the doctor, who can advise you on your individual diet plan depending on your individual preference and individual circumstance. And also you need to have a good team where they keep on communicating with you to keep an update on your progress or your problems, so that again your management plan can be modified accordingly. So you basically need, I think to me, 6 months is a good time which is needed to completely change your lifestyle and completely get on top of your illness. Basically getting rid of your illness in 6 months may or may not be possible. It might take slightly longer, but within 6 months, if you have a reversal program which lasts for about 6 months or so, you should get the hang of it. You should know what to do and what not to do. So I think that kind of commitment, longish term commitment of around 6 months is needed from a diabetes reversal program. I think these 7-day, 14-day internet-based programs is not one I would recommend. I would recommend a long-term clinic-based commitment from a experienced team. Is it a myth that you have to go to the gym to reverse diabetes. Yes, it's a myth that you have to go to the gym to reverse diabetes. You do not have to go to the gym to reverse diabetes. You can do enough exercise in your own home. You can do enough exercise in a closed room to help you reverse diabetes. Yes, some sort of exercise will be needed if possible, but obviously if you are an elderly or if you are somebody who's got some problems with their health who cannot exercise, you can still reverse diabetes by following the dietary advice. I think diet is more of a key than exercise, but a bit of exercise is always good. Yes, going to the gym and doing the right sorts of exercise will obviously help you more, but you do not have to go to the gym to reverse diabetes. You can do it from home. So the question is, can I continue to eat the food I love? Yes, but the problem with lifestyle change is that you have to change your diet as well. So you cannot carry on having the food you love at the same frequency and at the same quantity, because that is what has caused the problem you are in today. So unless you change it, how do you expect to get rid of your illness? So it's not that you have to completely get rid of everything forever. No, that is where your individual plan will come in from the experienced doctors and experienced dietitians. But yes, some food you have to change. You cannot just keep on eating the same diet and expect any result. So that is where the commitment needs to come from. But to answer in one word whether you can continue eating the food you love, the answer is yes, but the quantity and frequency perhaps needs to change. So the question is, will this type of program help obesity as well? The answer is overwhelmingly yes. I mean, changing your lifestyle will affect your obesity as well. You should be able to achieve a normal or near normal body weight after following the lifestyle changes. Maybe to begin with, there are some newer medicines which can help you in losing weight if you're a diabetic. But in general, if you follow lifestyle change and follow the right diet, right sort of exercise that you are able to do with the advice of your doctor, and with possibly help of some diabetic medications in the beginning, you should be able to improve your obesity significantly. Now, whether you'll be able to achieve your normal weight or not depends on how much exercise you can do as well. Without exercise, it's almost impossible to achieve a normal body weight. You can do it with very, very, very serious dieting as well, which again your doctor can discuss with you when you come for the program. But for the to answer your question whether obesity can be helped with this program, the answer is overwhelmingly yes. And obesity is, I would say, more of a problem than type 2 diabetes as such in the younger group, because maybe you can keep your diabetes under control with the newer medicine, but obesity, if you don't keep hold of obesity while you're young, then when you grow 55, 60, you'll have lots of other comorbidities. Most commonly we see knee problem, hip problem, back problem, chronic musculoskeletal problem. Those will limit your lifestyle severely. So all this hard work you're doing when you're young, you'll not be unfortunately able to enjoy the benefit of that when you retire if you have a lot of musculoskeletal problem. So that is only one problem with obesity. There's hundreds of other problems. Your heart, your liver, your overall risk of cardiovascular disease, hypertension, all these are linked with obesity. So obesity is a huge problem, and this kind of diabetes reversal programs, if it is done in the right way, should help your obesity as well.